It's time to adapt to a new normal as the country confronts the realities of coronavirus and says there is a long road ahead. Joining us now is the former director of the Centers for Disease Control, Dr. Tom Frieden. Dr. Frieden, welcome back to Fox News Sunday. And on a personal level, good to see you. We interacted a lot when I was in Atlanta. Both of us were there. Good to see you again.
Good to see you.
So let me ask you, first of all, where do you think we are heading with this? With the number of infections rising, where on the infection curve are we? Are we expecting tens of thousands of cases in the next few days and weeks, or are we expecting hundreds of thousands of cases?
Well, first off, we're in different places in different parts of the U.S. and different parts of the world, and that's why it's so important that state and local health departments and governments have a key role here in tracking what's happening locally, not only with the virus, but with the healthcare system, and advising people on what to do. Here in New York City, where I am today, we are really telling everyone, stay home. And in New York City, where the hospitals are getting overwhelmed, we're saying if you have mild illness, don't get tested. Stay home, because it's not going to change anything. Even if you're positive, we're going to say stay home. And if you go out there to get tested, you may use up testing supplies, use up protective equipment, use up time and effort of the healthcare workers. And if you're not infected, you might get infected. If you are infected, you might infect someone else. So mild illness, New York City today, stay home. Where we're going, first off, really important to get one key concept. It takes on average 5 or 6 days from the time someone gets infected to when they get sick, and about another week before they get very sick. So the severe cases we're seeing today are people who were infected 10 to 14 days ago. That means that for the next 10 to 14 days, we're likely to continue to see a big increase in cases in places like New York City. That's why we're so worried about healthcare becoming overwhelmed and keeping our healthcare workers as safe as possible.
Dr. Mike Ryan of the World Health Organization says that lockdowns are not enough. Reading a quote from him, he says, what we really need to focus on is finding those who are sick, those who have the virus, and isolate them, find their contacts and isolate them. But I was talking to somebody at the CDC just on Friday who told me that CDC is not really doing a whole lot of contact tracing anymore because now the disease is so widespread.
It depends on where you are. In a place like New York City, where we have tens of thousands of infections, maybe hundreds of thousands already, finding the sources of cases and the contacts isn't going to work. What you want to do is drive down new infections by these social distancing. Stay home, wash your hands, don't shake hands, stay at least 6 feet away from almost everyone, and then over the next 2 to 3 weeks, we might expect to see after that starts, with a lag of a couple weeks for the previously infected people, a drive down of cases, and that's when you restart really aggressive testing, contact tracing, isolation. Ultimately, what you want to do is tamp down cases. And anywhere in the country, anywhere in the world where cases are just coming in, you want to try to find the new cases. Anyone who's sick, isolate, identify the contacts so that they can be quarantined and isolated if they become sick.
And we know that you have personal experience with that as well in the Ebola crisis of a number of years ago as well, isolating people, treating them. In terms of a vaccine, we know that we're still at least probably a year away, but there is some promising therapies that seem to be on the horizon. One of them is an old friend that was used as an anti-malarial agent. It was given to every U.S. GI pretty much who went to Vietnam during the Vietnam War, chloroquine or hydroxychloroquine. Some evidence that in combination with a very common antibiotic, azithromycin, it can shorten the course of disease. But there seems to be some debate over whether or not that should be deployed. President Trump, very bullish on it. Dr. Anthony Fauci of the National Institutes of Allergy and Infectious Disease, a little more circumspect. Let's listen to both of them talking about it here.
We're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective.
I'm probably more of a fan of that than maybe than anybody. It's early, but we've I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety.
So the president has said, Dr. Frieden, what the hell do you have to lose? We've got this treatment, we've got this drug that's out there. We've known it for almost 70 years now. Do you think it should be tried? Should it be deployed?
We all hope there will be good treatment for people with severe infection with this virus, because that would make a big difference. Recently, just last week, 2 of the best antiviral drugs were tried in combination and they didn't show any impact. Things seem promising, but until you study them, until you really figure out, does it work, we don't know. So absolutely, I think we should urgently figure out whether chloroquine, hydroxychloroquine, azithromycin have an impact on the outcomes of disease. We have three goals here: reduce the number of infections, improve the outcomes in people who have infection, and reduce the societal and economic harms of this pandemic.
You say that there's two big stories coming in the next week. What do you see coming down the tracks?
Sadly, in places like New York City and elsewhere, I'm afraid we will see an increasing number of healthcare workers infected, some of whom may get severely ill, and the potential that we will overwhelm some of our intensive care capacity. That's what I'm most concerned about for the coming week. The models that we've seen and the trends that we're seeing are extremely concerning. Remember, I said it's about 7, 10, 14 days from the time of infection to severe illness. That means the severe illness we're seeing now was a result of infections that happened almost 2 weeks ago. And in those last 2 weeks, there's been an escalating number of cases. So the possibility of having tremendous stress on our healthcare system, our intensive care units, our nurses, our doctors, transporters, everyone who works in the healthcare system, and with that, more risk of infections in healthcare, more risks of patients dying. That's very concerning, and that's why in New York City and elsewhere, people are scrambling to try to scale up the capacity to care for patients safely, but that's not easy to do. This is very involved, intensive care.
When you were the director of the CDC, you were always on the front lines. We saw you there in Africa and all of your protective equipment as you were looking at what was going on with the Ebola crisis firsthand. Are you concerned that the Centers for Disease Control has been sidelined somewhat in the public aspect of this? I mean, we haven't seen Dr. Redfield for days now.
I would feel a lot safer if it were clear that the CDC is both at the table where the decisions are being made and at the podium where they're being explained. The CDC is the nation's leading health protection agency. One of the centers within the CDC is the National Center for Immunization and Respiratory Disease. They have more than 700 medical professionals who are experts in the understanding and control of infectious diseases. And in order to do more and protect people more, we need their full involvement. Fighting this without CDC central to the response has never been done with an infectious disease threat in the U.S. before, and it's like fighting with one hand tied behind your back.
The president is getting high marks from people like Governor Cuomo of New York, Governor Newsom of California for working with the states on trying to combat this virus. You've been watching there from your perch in New York City what this White House has been doing. How would you grade the president's response? Because he has been criticized by people as well.
This is not a time for grading. This is a time for all of us to work together, for every part of the federal government, for individuals, for people to pull together against a common enemy, a dangerous microbe. There's something everyone can do. Stay home. Wash your hands. Don't go out if you're sick. There's something that our healthcare system needs to do. Prepare for a safer surge to care for patients and also keep people who need their medications for hypertension or diabetes or other illnesses, keep them safe and on medications through telemedicine or refilled prescriptions. All of us can play a role, and one thing we have to do more is to understand this virus, how it's spreading, and how to control it better. The better we understand it, the better we can protect people.
Let me quickly, if I could, Dr. Frieden, come back to where we started, because you didn't give me a number at the beginning. Do you believe we'll see tens of thousands of cases or hundreds of thousands of cases here in the United States?
I think we already have many times more cases than have been detected. In places like New York City, we already have tens or hundreds of thousands of infections. There's no doubt from the information that we're seeing. The challenge is, what can we do today that's going to slow down this really exponential phase of the increase, this accelerating pandemic? And that's possible by people staying home, avoiding social contact. Yeah. We're all in this together, and what each one of us does can protect all of us.
One real quick question, if I could. Any idea how long this is going to last?
Very hard to predict what's going to happen. This is unprecedented. It's never happened before, but we do have, by working together within us, the ability to change the trajectory of this pandemic. What will happen in the coming months, only the coming months will tell, but what we do is within our power.
Dr. Frieden, always good to see you. Thanks for taking the time. Appreciate it.
Nice to speak with you again, John.